The Islet transplant procedure and follow-up information. When you get a call to let you know that it is time for your Islet transplant, you will go to the University of Alberta Hospital in Edmonton. The staff in the inpatient transplant unit will prepare you for the transplant. They will start 2 IVs. One is an insulin drip and the other is for transplant medicine. The Islet transplant takes place in the radiology department or in some cases in the operating room. An ultrasound machine is used to guide a needle and then a thin tube between your right lower ribs into a main vein, called the portal vein, just below the liver. The doctor gives you the islet cells through this thin tube. You will get medicine to numb your skin before you get the needle, and medicines to help you relax and manage any pain. The transplant takes about 1 hour. After the transplant, you will go back to your room on the transplant unit for the rest of your hospital stay. You will need to lie on your right side for 4 hours. This puts pressure on the needle insertion site and lowers your risk of bleeding. The healthcare team will check your blood pressure, heart rate, and blood sugars often. You will keep getting insulin and also get blood thinner medicine through your IV. Blood thinner medicine lowers your risk of a blood clot. Once these IV medicines are done, you will return to insulin injections and take a blood thinner injection for 7 days. You will have an ultrasound the morning after transplant and then again in 1 week to make sure there is good blood flow to the liver and to check for bleeding or any other problems. Most people will need to stay in the hospital for 3 to 4 days. Be prepared to stay in the Edmonton area for 1 month after your transplant. Your support person will need to go to appointments with you and help you during this time. There is a lot to remember. It's important to keep following your diabetes diet. The islet cells need time to settle into their new home, and we don't want to overwork them. Even though the transplant procedure is simple, there are still some risks. These include bleeding from the liver where the needle went in, a blood clot forming in the main vein of the liver, damage to other structures around the liver, infection from the needle or the transplanted islet cells, and pain or discomfort in the right shoulder or tummy that may last for several days. You will get medicine to help manage any pain. In rare cases, if your blood sugar levels drop to normal too quickly, it can cause bleeding in the back of the eye. The transplant team will follow you closely after your transplant. Appointments and tests may take up a lot of time and you may need to take time off work. Make sure you have a way to get to and from your appointments. You will go for blood tests at least twice a week for the first month following your transplant. After this time, you may not need to have blood tests as often. Having blood tests is how we know if the transplanted islet cells are working and if you are taking the right dose of medicines to prevent your body from rejecting them. You will need to come to clinic at least once a week for the first month, then again at 3 months, 6 months, and yearly after your transplant. It's important to test your blood sugar 7 times a day at home and record your results. The transplant team will let you know if and when you can start testing your blood sugars less often. You will need to keep seeing your family doctor, diabetes specialist, and any other healthcare providers for your general healthcare needs. Let the transplant team know if there are any changes in your medical condition or the medicines you take. An islet transplant can help improve your quality of life. And remember, your transplant team is here to support you through your transplant journey.